one more question on the kind of large language models as a tool for providers. In terms of the documentation space specifically and the note-taking space, one of the challenges that I think exists in today's healthcare system is the standardization of data across the board. Do you feel like large language models could be a tool for standardizing data so that when different systems, whether they be healthcare providers or payers or just individual doctors' offices, are taking notes, the ability to utilize that elsewhere, whether it's just to send from your primary care provider to the specialist that you have to see at the hospital, the heart doctor or whatever, or if it's in a larger way like de-identified data and research, those sort of things. Do you feel like large language models have the potential to solve a lot of the problems that professionals in the space are seeing?
So that I absolutely think is one of the strengths of where the large language models and machine learning, the combination of those things together really do have a potential to overcome that barrier that we thought was going to be solved with electronic health records, right? We thought when we get electronic health records, all of a sudden, oh, you should be able to see that, right? But that's not really how it worked. And the other thing that it is able to do is it is able to take unstructured data, right? So for example, images. So my live pictures of my echo in real life or that colonoscopy footage, right? That's not going to fit in an Excel sheet or those kinds of things, but it can also ingest that information and then be able to transfer it into your chart, right? Transfer not necessarily as an image, but with the appropriate verbal content, right? That's a key thing that is a difference maker because health records contain a whole number of things that fit in a box, right? Like, you have all those things that you checked off on your form when you signed in, but then there's a lot of free text, right? That is also mixed in there with opinions and, people thinking about things and interpretations and images, and it will be able to help organize and exchange a lot of that information that kind of gets lost from system to system. And it takes just some of the onus off of everybody having to move to the same way of identifying certain issues, especially because we are not, especially let's talk social issues, we are not in the habit as clinicians of calling out and structurally coding for and identifying some of the socioeconomic things that may be affecting our patients and their outcomes. But with large language models and the like, they can call out some of those things that are true, right? That we didn't code for, even though codes exist, right? And codify those things in a way that will allow, capturing, restructuring of resources and those kinds of things, because it was just sitting there in the free text.
Yeah. I mean, I even just think about middle name versus middle initial.
Yep.
Not that that's like the most key health information, but if you have two different systems and one's taking middle name and one's taking middle initial, and you want to combine that into one, okay, it's still a one step to take all of those middle names and turn them into a single initial.
Yep.
And then the downside being you lose that data.
Or everything is shifted over one box and everything that you got from that system is now incorrect because it put the thing after your first name as your middle name, even though that's your last name. And now no one has any last name and all the data is wrong. And again, when did you figure that out? After, because all of those things get found out after, right? When you need to look for it or use it after, because that's how life goes.